Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today we have Dr. Douglas Sborov, who is Associate Professor of Medicine at the University of Utah. He leads the myeloma and the plasma cell dyscrasia program there, and he's going to talk to us about some of the updates on Carvykti in the early relapse setting in multiple myeloma. Welcome, Doug.
Thanks for having me. Really happy to be here.
Okay, Doug. So we saw some updates at the International Myeloma Society meeting held in Rio recently. So we're just gonna, talk through some of these. So for our audience, can you first just give them a quick primer on what the CARTITUDE-4 trial design was, and before we launch into the discussion of the results?
Yeah, you bet. Probably start easy here. What is CARTITUDE-4? What is the CARTITUDE platform? It's a platform that is investigating cilta-cel or Carvykti in patients with relapsed and refractory myeloma. We have CARTITUDE-1. It was presented in the last couple of years, and that's looking at Carvykti in patients with later line disease. And CARTITUDE-4 is a randomized phase 3 trial looking at Carvykti or cilta-cel in earlier lines of therapy, so less heavily pretreated patients. So this is a study design. You can see here patients were required to have 1 to 3 prior lines of therapy, including a proteasome inhibitor and immunomodulatory drug. All patients needed to be refractory to lenalidomide. And importantly, no patients could have a prior BCMA, B cell maturation antigen, or CAR T therapy. Over 400 patients were included here. Randomizations 1-to-1 to either standard of care, which was either PVD or pomalidomide Velcade dexamethasone, or DPD, which is daratumumab pomalidomide dexamethasone versus cilta-cel. So those patients treated with cilta-cel would receive either PVD or DPD as bridging therapy. The primary endpoint is progression-free survival, and the secondary outcomes you can see here included rates of complete response, rates of MRD negativity, sustained MRD negativity, quality of life, overall survival, and safety. The last point to make here that's highlighted on the slide is based upon these results, the CARTITUDE-4 results. Carvykti was FDA approved for patients with 1 prior line of therapy, including an IMiD or